Hello, this is Vicki McGill, and this short video presentation is part of an education plan designed for nursing students regarding Parkinson's disease and its treatment with Sinemet. There are three objectives for this presentation. The first is that after watching the video, nursing students will be able to create a teaching plan, or in the case of LVN students, they would create a concept map involving a patient with Parkinson's disease and their family member being treated with Sinemet. The second objective is that nursing students will be able to apply their understanding of Sinemet's mechanism of action by giving accurate patient teaching during role play after watching this video. And the third objective is that nursing students will be able to illustrate characteristic movements and facial expressions of those persons with Parkinson's disease, again, after watching this video presentation. One of the first things that students would need to know and understand is what Parkinson's disease is. Parkinson's disease is the second most prevalent neurodegenerative disease in the world at present time. Unfortunately, it has no cure, and the etiology is still unknown. There have so far been no genetic, environmental, or lifestyle elements that connect directly with the development of Parkinson's disease. The main goal of treatment for Parkinson's disease, including the use of Sinemet, is to reduce the severity of its symptoms. Parkinson's disease is diagnosed generally by a neurologist, but it can be by a family physician, and they confirm that there is the triad of tremors at rest, overall muscle rigidity, and bradykinesia. Bradykinesia signifies that there are slowed movements. The characteristics of someone with Parkinson's disease are the stooping, forward-leaning posture. They generally have what's known as the Parkinson's mask, which essentially means that they lack a lot of emotive facial expressions. Their gait is very shuffling in nature, and also they have quite a few gait imbalances which lead to some significant falls. The use of Sinemet, whose generic name is carbidopa-levodopa, is prevalent, especially at the beginning of Parkinson's diagnosis. Levodopa actually aids in the production of the neurotransmitter dopamine, and it is a combination drug, so both levodopa and carbidopa are contained in one pill or capsule. And as the levodopa helps to produce more dopamine, the carbidopa actually decreases the rate at which the levodopa is metabolized through the peripheral part of the body. Therefore, that leaves more levodopa to be used up in the central nervous system by those that are taking it. The expected outcome for using the Sinemet is to reduce the severity of the symptoms, especially the gait imbalances and the lack of facial expressions. It's important that patients and their family members understand that the level of Sinemet in the patient's bloodstream needs to be maintained. They need to stick to the schedule for giving the Sinemet and not to miss doses if it's at all humanly possible. The learning plan is for students, once they're in the classroom, to break up into groups of 3. One student will perform the role of the nurse, and that student will be responsible for effectively teaching the patient and the family member about Parkinson's disease and use of Sinemet. The second student would be assigned the role of the family member. This family member would need to be asking questions and listening for the information that the nurse is going to be giving. And the third student would be playing the role of the patient and would be expected to accurately demonstrate some of the characteristic movements and lack of facial expression of those people that do have Parkinson's disease. Again, the learning environment would be inside of the classroom, either both after watching this video and perhaps even after a short lecture. The evaluation of the students' performances would be done through the use of a rubric. And the rubric would be specific to each one of the roles that the student was playing. Also, the way in which this activity links to the objectives is as follows. All right, the care plan or the concept map that the students end up creating should reflect their understanding of what the needs are of the patient and the family member as far as teaching. The second way would be that the student that is playing the nurse will give understandable information that reflects their understanding of the disease process and how the medication Sinemet is administered and the mechanism of its use. And lastly, this education plan would show that the student that is role-playing the part of the patient would demonstrate the correct characteristics of someone that actually does have Parkinson's disease and its unique effect on the body. After the role-playing is completed and the grades are given out, the other students that have observed this role play should be able to have a better visualization of what someone with Parkinson's disease looks like and what their teaching needs might be. Thank you.